So we have to continue our topic. We have to discuss now the qualities of a good dispenser. Attributes to cleanliness, accuracy, and honesty. So this refers to the traits or character traits of the pharmacists. We have to maintain our cleanliness, cleanliness in terms of our hygiene, in terms of our clothing, okay, accuracy. So we have to dispense drugs, dispense drugs according to the prescriptions, with the right dose, the right to the right patients, and honesty. So honesty is very important, especially that we are pharmacists. We handle expensive amount of medicines that is found in the drugstores, and sometimes pharmacies are also cashiers. So we are trusted by the employer or owners. So qualities of a good dispenser. So attitudes and skills requires to communicate effectively with patients. So if we have a good attitudes, okay, and we have a good skills, maganda po yung approach natin sa pasyente. At the same time, magaling po tayo mag-interpret, okay, in terms of patient counseling. So that leads to effective communication with the patient, so the patient can able to understand what are the information based on their prescriptions given by the doctor. Next, qualities of good dispenser. So good calculations and arithmetic skills. So good calculations, usually pharmacists are obliged to compute doses, okay, based on the age, okay, based on the weight of the patient, and of course arithmetic, especially in checking of stocks of medicines, okay. And if the pharmacists are in charge of the warehouse, so this is very important for the checking of the quantity and amount of drugs that are distributed or delivered by the delivery personnel of the warehouse or distribution company. Next, factors that influence dispenser behavior. So pharmacists can often be a patient's first source of advice. Yes, because we are expert in terms of medications, and therefore dispensers can greatly influence rational medicine use in the community, especially in the prescription of antibiotics. So when antibiotic is prescribed, so we pharmacists are obliged to explain, to interpret to the patients that the prescribed antibiotic should be finished. For example, if the doctor, the physicians prescribe 21 capsules amoxicillin 3 times a day for 7 days. So we have to explain that the patients will comply in order to prevent drug resistance in the future. Next, factors influence dispenser behavior. So we have training and knowledge. So pharmacists usually attend training workshops, okay. We have to attend also a continuing pharmacy education program, or continuing professional development, okay, and knowledge. So the knowledge that we have during our BS pharmacy course, or during our college days in pharmacy, so we have to remember that one, and we have to always update ourselves also different drug informations. Professional compensation in terms of salary and prestige. So economic incentives, so markup, volume of sales. So this is important when a pharmacist handles its own business, okay, or pharmacists that are involved in marketing, okay. Supply, out of stock. So we have to monitor out of stocks. So we have to forecast stock of medicines based on their offtake. So ano po yung napaubos